Hi, my name is Bjorn Garrido, and this is Victoria, who's a couch potato, but now wants to exercise. Victoria will experience cardiovascular changes in her breathing, blood flow, redness, heart rate, and cardiac output, and they will all increase as she exercises. The resting heart rate is 75 beats per minute. However, when it's running, it becomes 150 beats per minute, which requires more oxygen intake. Oxygen is required for ATP. The nervous system is the autonomic and the sympathetic. The autonomic system are things that you can't control, and the sympathetic is the stimulus. Blood vessels, the capillaries and the arteries will expand to allow blood flow to travel quickly throughout the body. The picture below shows that the centers are closed, which limits the blood flow transportation. In Victoria's case, the top photo will be useful to her because blood flow is more accessible compared to the picture at the bottom. Redness, she will be more red because the blood vessels are pushing towards her skin and they are trying to release heat from her body. The nervous system, the autonomic and the sympathetic nervous system, as she's running, her pupils will dilate. She's breathing more. Epinephrine is a hormone that is sent out throughout the body to help her run, and acetylcholine is the hormone in muscles to help run. The breathing is usually 15 times a minute. However, when it comes to running, it could be 40 to 60 times. The tidal volume increase, which means more oxygen and CO2 are being exchanged quickly. The bronchi, uh, the bronchi expands. It is by smooth muscles, and the trachea and the terminal bronchioles are affected by it the most. The benefits of exercising: it decreases depression, greater cardiac output. She uses the breathing capacity is efficient. She sweats more. Her bones are strong and muscles. Her muscles have endurance as she poops more frequently. The carotid artery is underneath the jawline, and you do not cover both because blood flow is needed in the head. The brachial artery is underneath the bicep. The radial artery is underneath the thumb, and you use the two fingers because the thumb has its own pulse. The femoral artery is between the groin. The popliteal artery is behind the kneecap. The posterior tibial artery is behind your ankle, and the dorsal pedis artery is between your big toe and your second toe.